So welcome everybody to our September resource sharing meeting. It's nice to see you all. And I appreciate everyone's fluidity and flexibility this morning as we work our way through our meeting. Christina, do you want to go to the next slide and I can talk about interpretation? So as we shared with you all when we met back in July, and some of you have been very involved in this conversation, we've committed to providing Spanish interpretation to all of our resource sharing meetings. So Sandra, thank you so much for interpreting for us and support with translation of the materials. And so for folks who would like to listen to the meeting in Spanish, you can click interpretation on the bottom right of your screen. It's the furthest icon over. Click the language that you would like to hear. So if you'd like to hear the meeting in Spanish, click Spanish. And then to hear the Spanish only, you can click mute original audio. If not, and Christina, you can jump in. You'll hear English at a very low level and Spanish more loudly. Is that correct? Okay. So yes, the instructions are on the screen, so we can leave those up as we let people into the room. And again, this is very new for us. And so it's new technology. It's a new way of working for us. And so please give us any feedback. If you have any thoughts, concerns, what's going well, what's not going well, we are always open to feedback. So please do let us know. A couple of pieces of housekeeping before we get rolling. If you could be sure to complete our demographic form and our evaluation form. Those will both be in the chat box that Christina will put in there. She has already put the demographic form in, and then we'll put the evaluation form in towards the end of the meeting, and you'll have an opportunity to give us feedback on this meeting in particular. And then by way of introductions, we have a pretty jam-packed first hour of the meeting. We have a number of speakers. So if you could just please go ahead and put your name and your organization and the role that you play at that organization in the chat box. That would be super helpful so that we all know who each other is on the call. And then we'll have an opportunity after our presentations to do some small group breakouts. So thank you, Christina. So just a reminder, we wanted to spend a few minutes. We do this a couple times a year, especially for folks who may be newer to the collaborative. We wanted to remind you all who we are and what we do and why we have our monthly meetings. So next slide, please, Christina. So just a reminder, our collaborative is a program of our Tahoe Truckee Community Foundation. We are comprised of 46 family strengthening, health, education, and social service agencies and nonprofit organizations, governmental organizations, who really work together to address the fundamental needs of kids, families, seniors, and all residents in the Tahoe Truckee area. So we've been around in some shape or form for almost 30 years, and that is at the crux of what we do. Next slide, please. These are our 46 partners. We also have 6 coalitions that are part of our collaborative. And so if for some reason you don't see your organization on here, please let us know. We really work hard to keep our partner list up to date, and sometimes we fall short. So please do let us know. And next slide, please, Christina. And just very quickly, what we do and how Christina and I spend our time. We really work to support communication, coordination amongst our partner organizations. We are seeking to raise our collective understanding, awareness around race and equity, and really looking at our work as a collaborative through an equity lens. We advocate for issues on behalf of our partner organizations, as well as kid families and seniors in the Tahoe Truckee area. We measure data, so we produce a community report card. We also have produced a safety net report over the last year. Since COVID began, we work to leverage and attract resources to the community, and we also seek to build capacity through trainings and conversations amongst our partners. So again, just a reminder of who we are and what we do. And again, we just do this a couple of times a year. So the other little piece of collaborative business I want to share before we get rolling with the agenda is I just want to very quickly go through our meeting agreements. And so we've always had meeting agreements as a collaborative. And since we began our more intentional conversations around race and equity, we realized that we needed to really update our meeting guidelines and kind of the framework with how we agree to work together and how we agree to kind of host and facilitate our meetings. So we've agreed as a collaborative to borrow from the Annie E. Casey Foundation, and these are specifically 9 meeting guidelines to help kind of create the container around conversations around race and equity. And we realize that they're transferable to all work as a collaborative, not just our conversations around race and equity. So I'm going to go through these relatively quickly. Sandra, I am mindful that I am a quick talker. So if I do need to slow down, you could just give me like a wave or something, and I will do my best to better pace myself. So our meeting guidelines that we've committed to as a collaborative: bring your best self. This requires self-knowledge and self-awareness. Be an active listener. Active listening involves paying full and careful attention to the other person. And we recognize this can be even more challenging as we continue to meet in a virtual world. Be kind and generous. Being kind and generous allows us to communicate better with others, to be more self-compassionate, and to be a positive force in other people's lives. Stay engaged. Again, a challenge for me in particular in a virtual world, but please stay engaged. And it requires you to be morally, emotionally, intellectually, and socially involved in the conversation. Staying engaged means that you are listening with curiosity and willing to deepen your understanding. So next slide, please. We have 5 more. Okay. That's yes. So be open and suspend judgment. Listening with an open mind includes being receptive to the influence of others. Suspending judgment also means listening to what the speaker has to say for understanding, not just to determine whether the speaker is right or wrong. Number 6, speak your truth. Speaking your truth in authentic and courageous conversations about race requires a willingness to take risks. It means that you will be absolutely honest and candid about your own thoughts, feelings, experiences, and opinions, and not just saying what you perceive others want to hear. And the final 3, Christina. Lean into discomfort. Leaning into discomfort will require you to let go of racial understandings and stereotypes that you may be holding onto in order to move forward. Leaning into discomfort will require you to sit through moments of embarrassment, confusion, anxiety, and/or fear. Number 8, enable empathy and compassion. Empathy and compassion allow you to understand the other person's point of view. And number 9, expect and accept that there might not be closure. It is not likely that you will resolve your personal understanding about race or another person's racial experience in a single conversation. The more you talk about race with another person, the more you learn and the more they will learn. So again, we just want to start off all of our meetings reviewing our meeting guidelines. I know it's a lot of words, but as we work towards really creating a space as a collaborative where we can have authentic conversations, not only about race and equity, but all the hard things and all the things that are happening in the community, I think it's really important that we remind ourselves about how we've agreed to kind of be together. So thank you, Christina. So I'm going to quickly go through our agenda for today. And we really want to recognize that it's been an incredibly difficult few weeks and traumatic weeks for our community. We know that folks on the call have been displaced. We know that folks on the call have really been at the front line of community support services or at the front line of systems where you continually have to like pivot your decision making to ensure that kids and families and seniors are have access to services. And we recognize how hard the work is. And so we really wanted to ensure that you all have up-to-date information around all the things that are happening in the community. So school opening up, what's happening with COVID, and what's happening with fire safety. So we kind of shifted the agenda today. So our plan was to have a speaker from the Washoe tribe come chat with us. And we did not want that conversation to be rushed. So we've actually moved that conversation to October. And again, I feel super strongly that a strong collaborative is a well-informed collaborative. And we really want to ensure that you all have, again, up-to-date information and have opportunities to ask questions about all the things happening in the community. So Superintendent Chief Learning Officer Carmen Geisels has joined us this morning. It's the first day of school. So we let her know if she couldn't be on the call, like that's okay. But Christina, maybe in a sec, I will turn it over to you. You can let me know if she's on the call. We are going to hear from Raoul with Placer County. So thank you for joining us, Raoul. And Cindy Wilson with Nevada County. So thank you for joining us to talk about COVID. And then we're going to spend a chunk of time hearing from our offices of emergency services with Placer County. So Dave Atkinson, Robert Womack with Nevada, with the town of Truckee, and then Paul Cummings with Nevada County. So again, that's the first like hour and 15 minutes of our meeting or so. And then we'll do some resource sharing amongst our partners and have an opportunity to do some small group work. So that is our plan. So Christina, I'm trying to see if Carmen is on the phone with us. She's not on the phone. Okay, that's okay. We kind of knew that she might not be able to be here. And so we had given her an out. So Raoul, are you okay if we turn it over to you for an update on all things COVID with Placer County?
Sure, more than okay.
Thanks, Raoul. Good to see you.
Good to see you, and good to see everybody here. So I'm Raoul Martinez, Assistant Director of Placer County Health and Human Services. So I guess we're one of the many socios on that was listed a few slides ago. So nice to see everybody virtually again today. And thanks again, to you and Allison and Christina for organizing this. So providing a Placer County COVID-19 situational update to everybody here. I'll focus my remarks on COVID's impacts to Placer's critical infrastructure, including our hospitals that are based in Placer County. We actually don't have any county-run hospitals. We have hospitals that serve based on a regional model. I'll talk about our schools and also the health warning that we issued about a couple of weeks back. So it's worth underscoring for everybody that we've been saying this for a couple of months now, right around the retirement of the state's blueprint for a healthier economy. So that was retired on June 15th. And around that time, sort of underscoring the point that Delta is different. It's different in its ability to find unvaccinated groups of people and quickly spread. So if you've been paying attention to the news, this shouldn't be new. And studies show that people infected with Delta can carry 1,000 times the viral load as those infected with the original virus, and much higher than even some of the variants, including Alpha. And so that unfortunate reality is forcing many of us to adjust some of our previous assumptions, hopes, and plans. I think everybody on this virtual meeting had hoped for a different summer than what we've experienced so far. So how does that affect case rates? So Placer's case rate stands at about 40 cases per 100,000 residents. Our dashboard, our data dashboard, will be updated today. I'll stick that in chat in just a second. And so we have about 40 cases per 100,000 residents, yet we see a marked difference in case rate based on vaccination status. So the case rate among the unvaccinated stands at about 63 per 100,000 and 15 per 100,000 for vaccinated residents, right? So huge divide there. And it appears that the overall case rates may have started to plateau, at least for now, so that's good news, yet they're plateauing at a very high rate, which indicates, continues to be significant community transmission that's on par with what we saw during the winter peak. That impacts hospitals, right? So COVID has placed a significant strain on Placer's health system, and an overwhelming majority, like you're seeing in other communities throughout California and the nation, an overwhelming majority of those hospitalized being unvaccinated. The number of patients hospitalized for COVID now exceed our winter highs. And while it looks a lot like the winter surge, this surge is different in a number of ways now that vaccine is widely available. About 90% of those that are being hospitalized are unvaccinated. In the winter, infections in older adults, especially residents of skilled nursing facilities, were a major driver of hospitalizations and deaths. And now that about 85% of seniors and an even higher percentage of skilled nursing facility residents are vaccinated in Placer, most hospitalizations are due to community transmission, and the people that are being vaccinated, that are being hospitalized, are much younger than they were during the winter surge. Things are even worse when you look at ICU hospitalizations due to COVID. Which far exceed our winter peak. We had, as of our last reporting, about 54 cases in ICU. Again, Placer's hospitals have done really an amazing job over the last 18 months adjusting to many different challenges. so they can be there to serve the community. Yet all hospital services are impacted when COVID community transmission is as high as it is currently, which is why it's in our collective best interest to really bring down transmission as a community and as a region. So how does this actually impact all of us, right? So if someone experiencing a stroke or a spinal cord injury right now, there's actually a good chance that they're going to be sent home rather than to a rehabilitation bed, because hospitals are using those beds for acute care due to the COVID surge. I'll also say that in parts of San Joaquin County are now starting to exceed thresholds, which means that neighboring communities have to open up their beds and doors to transfers. The problem is there's nowhere to transfer them to, right? So the beds are all being taken up. So this is affecting not just Placer County and the hospitals and those that get access from those hospitals, but neighboring communities as well. Schools are also starting to see the Delta difference. We had the experience in Placer of being one of the first counties in California to have students return to in-person learning in the fall of 2020. My kids were included in that as well. Our schools have worked really hard to prevent the spread of COVID in our schools, and we ended up actually seeing low rates of in-school transmission last year. We all know that kids, need to be in the classroom, and in our experience last year, helped us give us some confidence that our schools could safely provide in-person learning. And like the hospitals, the schools have really stepped up to all of the challenges that the pandemic has thrown their way to maximize in-person education as much as possible. But much like our conversations with the hospitals, and we're on the phone with hospital execs and sort of directors of ERs every week, the tone of our meetings with school leadership in the last couple of weeks has become increasingly marked by growing concern. Again, Delta is proving to be extremely efficient at spreading quickly through unvaccinated groups, and we still have large numbers of unvaccinated children in our schools, some of which aren't eligible, right, to receive vaccine yet. And so, the high rates of community transmission that we're seeing are putting a strain on our schools. So last year we saw community link cases, but we're now also seeing, again, one, the emergence of what appears to be in-school transmission, and two, some full classes have already temporarily closed due to what appear to be apparent outbreaks less than 3 weeks into the school year. A few more things here on my list. Vaccinations have climbed recently, yet there's still opportunity for growth. Vaccinations administered per day had been pretty much in a constant free fall since our peak in April, yet have started to gradually climb again. Placer currently stands at about 61% of the total population has received at least one dose. 71% of the eligible population has received at least one dose. So that leaves us with about 100,000 residents, eligible residents who could be vaccinated, and I'll say, including a notable share in the 18 to 34 age group, right? And so I want to underscore that a bit, because some within that age group have kids that are going to preschool, kindergarten, elementary school, and and so we're concerned about kids bringing COVID back home to their parents and having and sort of perpetuating kind of the community spread that we're seeing. You've all been seeing recent developments. We've gotten full FDA approval for Pfizer for 16 plus. Additional doses are available for immunocompromised folks, and there's the potential for boosters, yet that timeline remains in flux. You've heard a lot about September 20th. It's likely going to be pushed back a bit. Sort of, aspirationally, that's tough. Operationally, it's probably, we're looking at late September, October, and first dose is probably going to those healthcare workers, sort of the first that were in line when vaccinations opened up. I'll just end by saying, so on August 25th, Placer County Public Health issued a health warning to help warn residents of the impacts of our high rates of community transmission on our critical infrastructure, right? So again, hospitals and schools. and urge residents to take steps to protect themselves, their families, friends, and their community. And, once again, urging those that haven't been vaccinated to go talk to their doctor if they have concerns or questions about vaccine, and get those questions answered as soon as possible. And we're also advising all residents, regardless of vaccination status, to use high quality masks while in all indoor settings to protect against Delta. So think of these as sort of three categories, right? So you've got cloth, bandanas, and gaiters are less effective, more effective than wearing nothing at all. Fitted KN95s and double masking, sort of medical and sort of surgical masks and cloth together is better. And N95s are best, but can be tough to wear, and folks that get those should get those properly fitted. So I don't know, many people that love, wearing masks. I certainly don't, but if you're going to wear one, you may as well have some good filtration. So we're telling folks to use a higher quality mask. We at home have gotten KN95s for our kids when they're going to school. So that's my update. Thanks for the time.
Thank you, Raoul. And I think we'll turn it over to Cynthia with Nevada County, then we can open it up for questions. And then Christina, my internet's going in and out a little bit. So if I get kicked out, would you mind just keeping the meeting going? Thank you. Okay. All right, Cynthia with Nevada County, thank you for joining us.
Good morning, everybody. I'm Cindy Wilson. I'm the Director of Public Health Nursing here with the Nevada County Public Health Department. And thank you, Raoul, for covering a lot of the important updates that pertain to everybody, no matter which county they are in. And I think that everything Raoul said is very similar to what's happening in Nevada County. A lot of increase in cases, some increase in demand for vaccines as a result of the increase in cases, and also a significant increase in the demand for more testing capability and capacity so that people can determine if they're having symptoms, if it is indeed COVID or not. As of the end of last week, Nevada County had reported 7,524 cases of COVID over time, the whole time of the pandemic, and we've reported 86 deaths. About 21% of those cases have been from the eastern part of the county, and the remaining 79% would be from the western part of the county. So population-wise, you guys comprise more than 21% of the county. So relative to the western part of the county, you're actually doing a little bit better. We too have been very concerned about what has been going on in some of our critical infrastructure, such as hospitals. And in addition to that, the opening of schools has created a lot of COVID situations that we would have preferred to avoid and hoped we could, but then Delta variant showed up, and the elimination of the economic plan tiers around the same time have really created just a situation where COVID has exploded here in Nevada County as well as other places. So the last hospital update that I have from Tahoe Forest Hospital is about a week old, so it's probably not current anymore, but at that time there were only 2 COVID patients in Tahoe Forest Hospital, and neither of them were residents of Nevada County. Both of them had actually been evacuated from Barton Hospital as patients there and were admitted to Tahoe Forest. And of course, Tahoe Forest Hospital has a catchment area that includes a number of counties as well as some parts of Nevada. So even when we have data, we're mostly concerned for ourselves about the Nevada County residents, whereas residents of the high country, you guys have relevant concerns about anybody who's admitted there, whether they're from Nevada County, Placer County, or one of the neighboring counties. Tahoe Forest Hospital has seen less impact than the other hospital in Nevada County, which is Sierra Nevada Memorial down here in Grass Valley, but it is still very difficult because it is a small hospital. And so even when there's just a few patients, if they're critically ill, it has the impacts that Raoul was describing, that people cannot access some of the more routine medical care if the hospital is impacted. In addition to that, it means that people are waiting for emergent care. So if somebody's having a heart attack or a stroke, they may have to wait for more time than is really good for them to receive the care that they need. So the 86 deaths, one of questions that we get often is how we report deaths. And so I just wanted to give you just a little bit of information about that from Nevada County. And one of the kind of media accusations is that deaths are overreported. From my perspective, that is not true. Deaths are probably actually underreported because we here in Nevada County wait to put on our dashboard a COVID death until the death certificate is certified. And that means that the attending physician has signed off on it and has said that COVID is a cause of death, either a primary or a contributing cause of death. And we know for sure that there are some cases in our county where somebody had an underlying medical condition, such as cancer. They were expected to die, they were in hospice care, and then they got COVID. COVID may have contributed to hasten their death. It did not show up on their death certificate, and so they are not counted in our death count. And so if people are thinking that it's overcounted, it's probably actually undercounted. The other thing about the case count is somewhat similar. We count confirmed cases, and so that means somebody who has a lab certified PCR test that is positive. In addition to that, we can have people who are suspect cases and other categories. And so, for instance, somebody who is a contact, a household contact, and they have an antigen test, that is not somebody that even gets counted in our case count because it's not a PCR test. So both the case counts and the death counts are underreported probably for every single county, and not just in California, but throughout the nation. So that's just something to keep in mind when we're talking about data and when we're looking at the county dashboards and other pieces of information. The schools here in Western Nevada County opened earlier than the schools up there. I'm sorry that Carmen could not be here to provide an update to all of you, but it is a place that has caused a lot of concern, even in the short period of time that they've been opened. And there seems to be a lot of difficulty in having the schools set up some of the requirements for kids to be able to come to school and for it to be safe for all the kids. In order for that to happen, they need to be able to do case investigations and contact tracing, because they're the ones who have the information about who is in a classroom and who sits next to whom. And so who would have been within 6 feet. They also have better access to the kids and the parents than a public health department does when we try to call. And so the schools need to have a case investigation contact tracing program that is well enough developed that they can do that. They can follow up with positive cases and figure out who is a close contact and who needs to be placed into quarantine, and do that quickly in order to keep the spread down. In addition to that, there's been a lot of confusion over the course of the last few months about what it means to be in quarantine. We've had all kinds of situations on both sides of the county where a school-age child was placed into quarantine, and somehow, some way that was interpreted as you can't come to school, but you could do anything else. So they have attended extracurricular activities through the schools. They have gone to parties for high schoolers, and they have participated in club sports and things like that. So we really need people to understand that if you are placed into quarantine because you're a close contact, that really means you stay home. The schools down here within a short period of time have discovered that the state allows a modified quarantine based on some testing criteria, and the schools here have not been able to manage to get that done. None of them have had a testing program set up that is robust enough and that they can test at the right intervals, track who needs to be testing and who has tested, and allow kids back appropriately. So our recommendation down here has been that the schools go to the 10-day quarantine. And that's just it until they get their testing situated, because trying to do modified quarantines and making up your own rules just does not work. And there are lots of people who want to make up different rules than the ones that the state has put out for schools. And so there is guidance from the state There are a lot of documents. It's a little bit cumbersome to try to read through all that and try to interpret it. But that is what parents and schools need to be doing to try to figure out how the best way to contain COVID within the schools is going to be, and how to move forward in a safe way for the kids in your school districts.
Cindy, I'm just going to interrupt you for a quick second. We're a little bit over time, and I think Carmen just joined, perhaps.
Okay.
Carmen, if you want to give and again, we're over time, but if you just want to give a couple minute update, and then we can open up to Q&A before we move on, if that's okay. So I apologize for interrupting you, Cindy. I'm just mindful of everything this morning.
Great.
Carmen, are you on? And maybe she's not on. Okay. All right. So did you have anything else, Cindy, before I move?
My next sentence was going to be, I think that's probably all I need to say. And that if people do have questions, Raoul and I can try to answer them. I may not know all the answers. I myself have been off work since last Wednesday, so I'm a little behind, but I'll try.
Okay. Thank you, Cindy. So questions for Raoul or for Cindy? And you can put them in the chat box, or you can just raise your virtual hand, or you can just jump on in. No questions. Any questions? Am I missing any, Christina? I don't think so.
No, and Superintendent Giles, sorry, I'm not pronouncing her name right. She is at Donner Trail Elementary School, and so she wasn't sure that reception would be great. So if I see the phone number come back in, I may just interrupt you guys.
Okay.
Again. But I know she's driving in between schools today, being the first day.
Okay. Well, I would just say, Roland. Oh, go ahead.
And I was just going to say, again, to be kind to healthcare workers in particular right now. I think one of the big differences between now and the winter was our healthcare workers, particularly those on the front lines working in the emergency room, the ICUs, they were exhausted, right? So, and vaccine was the light at the end of the tunnel. Right now, they're exasperated, right? Because the folks that are in a hospital don't need to be in the hospital. We've got 90% of patients in Placer's 3 hospitals that are unvaccinated and much younger. And the level of acuity that our hospitals are seeing is quite pronounced, right? So it's COVID and everything else. So a third of the hospital beds right now in Placer are being occupied by COVID patients, which impacts all hospital operations and is really taxing on healthcare workers. So, so if you know anybody, check in with them, give them, our thanks. But I think it's a moment once again to really be kind, and probably we need more than that, to be quite honest. But it's really impacting our hospitals in particular right now.
Thank you, Raoul. That's a really good reminder, and I think especially for folks on this call who interact with so many people to help spread that message as well. It's a really helpful reminder. So any other comments or questions for Raoul or for Cindy? Okay, well, I really appreciate the really thorough updates. It's really helpful to get a deep understanding and a comprehensive overview of what's happening with COVID in general, with Delta in general, and then what's happening in each of the counties. And both Raoul and Cindy put links to the county dashboards in the chat box. And so please take a look at those. And again, we really appreciate you joining us this morning and for your good work. And I know it's been a long haul, so thank you for fighting the good fight. We are grateful.
And Allison, I think we have Carmen on the phone.
Okay, so Carmen, I'm going to turn it over to you. Welcome. Happy first day of school. I understand you have spotty cell coverage. So if you just have a couple minutes, if you just want to give everyone a quick update, there's about 42 people on the call, 42 of your closest friends and colleagues.
Thank you, Allison. Chris, I apologize. I was trying to unmute myself the first time, and I couldn't get to it in time. So thank you. I am so sorry I'm not on the Zoom call. As you know, we started school today for the first time this year. We had pushed back our start date from the 31st to the 7th because we had some district boundary areas that were in the mandated evacuation, which have impacted about 150 families, which also included staff, classified, certificated, and administrative staff. So we're glad that the mandated evacuation was, I believe, called off yesterday. So I've been at the lakeside. I'm now heading to Donner Trail Elementary, and we're open full 5 days, all day. Our students are wearing masks. We're going to be in alignment with the CDPH guidelines. We have air purifiers, the MERV 13 filters. We have fans if we need them. We are ready to go, and we're
And Carmen, we may have lost you, but we appreciate the update. I don't know if you can still hear me. Okay, well, we all driven up on Donner Summit. We know, like, right around Donner Trail, the cell coverage gets real sketchy. So thank you for the very brief update.
I know, I'm sorry about that. It's just that I intended to attend in Zoom today, but with the pushback and everything. So I'm trying to make as many school sites as I can today.
Yeah.
And I'm headed up to the Truckee side now. So it's been great seeing students in classrooms, and we're really excited to be starting school.
And we are really excited to be sending our kids to school. So thank you for everything your staff has done over the last several months and last year, and especially over the last several weeks to get the schools ready. So we are very grateful. So thank you.
Thank you. And I did hear a little bit about the quarantining. So we are working on making sure we're in alignment with quarantines should the need arise. We're hoping not too many, but we have a process in place also for our school district as far as quarantines are concerned if there's an exposure.
Thank you, Carmen. That's great to hear. Okay, well, we won't keep you any longer. So if folks have questions, you can maybe just put them in the chat box and we could email them to Carmen or get them to her somehow. Okay, thank you.
Sure. You can email them to me and I'll get them back to you. Again, my apologies. Timing was not the greatest, but I really want to be able to get to the sites today and celebrate that we're finally back. Even if we have masks on, we're finally back.
Yes. Well, thank you, Carmen. It's good hearing you.
Okay.
We'll talk soon.
All right. You guys have a good day. Take care. Bye-bye.
Okay. Okay. So again, thank you, Raoul and Cindy. Thank you, Carmen. And we are going to transition to the other kind of like hot topic in the community, and really like the one that's consuming almost everyone's mental, physical, and emotional wherewithal in addition to the COVID. And that's really what's been happening with fire season, with fire safety, certainly with the Dixie Fire and the Calder Fire. And so we are really grateful that Dave Atkinson with Placer County's Office of Emergency Services has joined us today, Robert Womack, who is the Emergency Services Coordinator for the town of Truckee, as well as Paul Cummings, who is a Program Manager of Nevada County's Office of Emergency Services. And so the way we've structured the next little chunk of time is that we've asked each of the speakers to give kind of like a 5-minute overview of any updates, what's been going on, what's helpful for our collaborative partners to know, and then we're going to really open it up for questions. And then when we get to Q&A, Christina and Sandra, maybe we can try to figure out how to get questions from the Zoom room that's being interpreted in Spanish back to this room. So we may need to kind of, I just ask for everyone's patience on that, I guess is what I'm saying. So thank you all for being here. And Dave, we will start off with you.
Good morning, everyone. Hopefully you can hear me okay. Maybe somebody give me a nod. Perfect. Awesome. Well, I really appreciate this opportunity. My name is Dave Atkinson. I'm the Assistant Director of Emergency Services for Placer County. Been in the position, let's see, not quite 5 months. Already had a busy summer, unfortunately. So in terms of things going on here in Placer County, as I'm sure everyone knows, of course, we've been dealing with the wildfire smoke from all of the other fires around, and that's obviously posed a lot of challenges. And you've seen the health advisories that have been coming out. And then, of course, we had the river fire that impacted both Placer and Nevada counties. And then I know Nevada County had another fire there in Grass Valley. And then actually, I'm just coming off a weekend of responding to the bridge fire and how to deal with possible evacuations when the main route is cut off. So we have unfortunately had a busy fire season, and it's not over yet. I did want to just maybe share one kind of really quick kind of important message, and that's just talking a little bit about authoritative information during disaster. We as emergency managers recognize that information is incredibly important, and getting authoritative information out, especially as with the previous topic with COVID and also with disasters, just making sure that good, solid, authoritative information gets out there. And so really how we want you to think about that is just like kind of all the other aspects of personal preparedness. And that starts with making a plan. And, you know, take the time now before the disaster to find out, you know, what are the trusted sources of information in your area? And that may vary depending on the type of information. In a lot of jurisdictions, law enforcement is responsible for evacuations, but your public works might be responsible for road closures and things like that. So just find out who those folks are and how they're going to communicate. Is it through some kind of opt-in messaging? And Nevada and Placer are both fortunate. We have 211 and they have some great text services available. Actually, I know for COVID, they've been using that pretty extensively. I've signed up for that and that's a great option. And some other jurisdictions also have opt-in services. So if you have those available, please sign up for them. I know from my kids' school, we get robocalls fairly frequently. They actually reached out to us during the fire this weekend, which I appreciate greatly. Of course, there's a lot of emphasis on social media, but we really want you to be careful about that and be mindful. And then you may even, in some areas, have a looped message, you know, kind of like the old weather radios. Again, here in my local jurisdiction, the fire department here has an AM radio station that they loop public service messaging on. So just understand what those are. Second, build that kit, right? So depending on how you're going to get that information, you know, how are you going to make sure that it's available to you even in some kind of an emergency? If it's radio, make sure you've got batteries. I actually just this weekend pulled out a portable transistor radio. My kids were amazed. They'd never seen such a thing. And I had to explain to them, you know, in the old days, this is when I was a kid, you know, I'd have this under my blanket at 10 o'clock tonight. It was kind of my entertainment. So a little bit different than them with their iPads these days. And then of course, cell phones, right? We want to make sure you've got portable batteries, all your charging cables, all those kinds of things. I try to spread charging cables all over the house and in the cars because I never know where I'm going to be. And then of course, be thinking about your special needs, right? You know, some folks, if they, whether it's different languages or perhaps hearing impaired in that, you know, if you have a special need or their family members that have a special need, you know, make sure you're taking full advantage of all the great technology that's out there for that. And then of course, lastly, be informed, right? If something's happening, maybe it's not impacting your area, but it's coming. Again, the Calder fire is a great example. And, you know, our folks on the West Shore, you know, start being actively monitoring that. Again, we don't want you to be anxious or disaster junkies like some of us have to be as a part of our day jobs, but just stay informed. And then of course, probably most important is we really want you to really evaluate those sources of information, right? A lot of times information is getting repeated by folks, but it may not be current. It may not be reliable. Always make sure it comes from an authority. And then always ask yourself, who's posting this and why are they posting it, right? Are they doing it to inform, to try to spread the message, or is there some other reason behind it? And I guess lastly, and maybe we can talk about this a little more in the Q&A, I'm always looking for, you know, as an emergency manager, you know, we always feel like we can do more and we're missing something somewhere. And so I guess I would just ask this group, you know, for the populations that you serve, is there some other mechanism or way that we can be communicating with the communities that you serve that maybe we're not engaging? And that's all I had. Appreciate the opportunity.
Okay, thank you, Dave. So I'm just kind of jotting those questions down so we can revisit those after Paul and Robert speak. So thank you very much. So Robert, I will turn it over to you to talk about Town of Truckee. Thank you for joining us today.
Sure, thank you. And just to kind of make it so it's a little bit easier to understand, you know, in emergency management, we talk about all things start local and end local. So when we talk about the town of Truckee, if we can handle it locally, then we will handle it. But that's where Dave and Paul come in, and I work very closely with both of them. If I need resources, then I go up to them and I ask for resources. And if they can't, then they go up to the state and ask the state for resources. So just to give people kind of an idea of why there's such an overlap, it's because if we can handle it locally, we will. The other thing I wanted to do real quick is thank everybody for the amount of donations, outpouring of goodwill, and everything we got at the Truckee shelter that supported the Calder fire. It was amazing, and it continues to be amazing. And every guy I talked to with American Red Cross is just over the top, talks about how great this community is at providing resources for its different folks, from the folks that brought food to some of the donations we received, and then also some of the cash donations that occurred. So it was just really an awesome outpouring. But really what I'm going to talk about today is kind of dovetails off of what Dave talked about, and that is community resilience. So once you hear that message, what does that really mean? And the first thing I'll start off with is understanding that government can't do it all. People look towards us often in times of emergencies when we're at the most stretched in terms of what we're able and capable to do. To give you an idea, the Caldor fire has over 160 officers, police officers from mutual aid working on it, or it did at one point. It's back down a little bit. We don't have that kind of resource. Typically, Truckee has maybe 2 or 3 officers on, and the CHP will have a similar number. And so when you start talking about what we're able to do, the things that we're able to do are to try and facilitate evacuations, to try and quite honestly, do traffic control and things like that. So when we get past that, then we start looking at what can people do to help other people. And I think that's where we talk about resilience as being the most important thing. Neighbors helping neighbors. So if you're a neighbor that, next door is an older person or somebody that is access and functional needs, what are we doing as neighbors to try and help them? Are we making sure they got out okay? Are they getting the message? Have we made sure that they're all getting messages and have heard about it? I tell people they don't have to evacuate their whole community. What they do need to do, though, what really helps, particularly since we have such a transitory population in many different ways, is make sure that your neighbors know. Knock on the door and say, hey, did you hear that we're evacuating? Or I just heard the information that something's happening and we're in a warning area. So those kind of things can really help people understand what's going on. Again, to Dave's point, we got the information, but now we need to relay that to our neighbors. And then, as I said, it really becomes an issue of trying to make sure that we're helping different people where we can, and where we try and be able to make sure that if somebody needs help evacuating, don't look towards us to be, as in law enforcement, public safety, to be the answer. Now, I'm not saying that we got to go out and carry people downstairs or anything like that. There's reality to what we can do. But when it comes to just making sure that your neighbor gets out, that they have a way to get to wherever they're going, if they're a one-car family, something like that, what have they done for their kids? One of the worst things that happens is, and this is not just the way things are, parents have kids at home after school and they're not able to drive. They're not 16 yet, but they're able to stay at home alone. Probably they're a little older now than we used to think when we did this, but nonetheless, kids are at home. Did somebody go over and make sure and grab those kids? Is there a plan? Dave talked about having a plan. Have you talked with the parents in the neighborhood? Is there one central place where all the kids are going to kind of load up because that parent is a full-time homemaker type parent who is, one that's home. And so all the kids will go to that house, load a car and go from there so that we don't leave anybody behind. Because those are the kind of things we look at in trying to help people. And then, that makes it a little bit easier for the other parents. One area that's really difficult, that's, and Dave mentioned a little bit, and I'll dovetail off this also, is how do we deal with our population that is completely unsheltered? And, what are we doing about moving them? And that's a very difficult situation. And I'll be the first to tell you that our transportation assets immediately following an event or during an event are going to be really stretched very thin. We just don't have a lot of transportation on the east side of the counties. So what are we going to do in terms of helping them? That becomes very difficult. First off, we have to get them the message. The second off, we have to find a way to get them moved to a different location if that's what's necessary. So those are things we're working on and we continue to pay attention to, and I'm certainly open to any ideas that somebody might have. So that's about it for me. Quick update.
Okay, thank you. That's really helpful to hear. And I feel like I've been hearing a lot about community resiliency lately, so thank you for reiterating that. Okay, Paul, can we turn it over to you before we open up to Q&A?
Good morning, Allison. Good morning, everybody. Thanks for having me. Paul Cummings, I'm the Nevada County Emergency Manager, Bob Womack and Dave Atkinson's equivalent for Nevada County. So like these gentlemen have said, we've been really busy with response and recovery this year for the wildfires. I think we've seen that climate change and drought have really just driven another unprecedented wildfire season. And we're watching these fires when they kick off, like the Bennett fire and the River fire, and they're just explosive. The fuels are just so receptive and ready for fire. The spotting out in front of these fires is incredible. So what does that mean to this group? I think it means, just like you've heard the other two gentlemen say, we've got to do everything we can to prepare this community to get out as quickly as possible ahead of these fast-moving wildfires. Our office, like the other two offices, are very involved in recovery. The River fire affected, destroyed 53 homes in Nevada County. So we're trying to help those folks recover. We're trying to protect the Bear River, and we're trying to also help with the public assistance side of recovery. We've also been very focused on alert and warning, trying to make sure that we push all these tools, make sure they work properly, that everybody's educated on them. These are things like Code Red, Nixle, wireless emergency alerts, the radio, all the different things we use, the high-low siren to get the message out to the public. But when we use those during actual fires, like we have for the Bennett fire and River fire, they've generated a lot of questions. So we've been trying to deal with that. So the last couple of minutes, I did just want to talk about something that's kind of a new threat to the east side for at least, the Nevada side, and I think a little bit on the Placer side, is this public safety outage management, PSOM. Like it's equivalent to PSPS down on the west side. If you haven't heard, the utilities are going to turn off the power when there's high fire danger, right? Those are the days when the wind is blowing, the humidity is low, the temperatures are high. The temperatures don't always have to be high, but when conditions exist that could threaten their infrastructure, where power lines may come down, like we saw for the campfire and start a fire. So they're turning it off to protect the public. They're turning it off to protect their infrastructure. And as many of you know, Nevada County and Placer, we live in a very high and high fire severity danger zone. So that's why they're doing that. So what happens when they do that? Well, I mean, in Nevada County on the west side, we had to kind of figure this out in 2019. And so these were multi-day outages that affected a lot of the community. And which populations were most affected? People with disabilities and older adults, right? So we had to really try to work with our nonprofit partners to try to shore up those gaps. So, here in OES and emergency management, we're trying to ask a lot of questions of the utilities. How many events are there going to be? How long are they going to last? How many customers are affected? What are you as a utility doing to lessen the blow, to mitigate the impact on the community? These are things like microgrids, giving batteries maybe to people who have durable medical equipment. Putting together community resource centers where people can get information and go charge that durable medical equipment maybe during the day so they can make it through the night. Telecoms, right? Who's working with the telecoms to make sure that the phones work? Because we're already looking at a high fire danger day, so the fire threat's high for all of us, but then the power is going to be off. So how do we message people when there's a fast moving wildfire if the power's out and the phones don't work? So we're trying to close those gaps as well. We know that it affects schools and businesses because people have to make decisions around, well, if the power's off for the next 3 days, do I open my business? Do I go shopping to stock up, my fridge? Can school be open? How are we going to work around that? So we know that there are many layers of challenges, and that's where, Bob Womack and Dave Atkinson and I are working together with groups like yours and the utilities to try to plan out for those things that we know are going to happen. And again, to try to prepare the community, because the community, I think, is the theme you're hearing. The community has a certain level of personal responsibility because we just don't have enough resources to support everybody when these events occur. So big picture, we are tracking a lot of events, and they're in some ways intertwined, right? Drought, climate change, heat events, red flag warnings, fires, and public safety power shutoff. There's a little bit of a nexus there and an overlap, and we're trying to close those gaps where we can. But I'll stop there and take any questions that you may have.
Okay, thank you, Paul. That's really helpful to hear. It's really helpful to hear. Okay, so questions from the group. And we really encourage you to think about your, again, as was reiterated, your personal life, your neighbors, your family, and then also all the folks that you interact with within your organizations as part of our broader collaborative So it's really an opportunity for you to ask any questions, any comments, anything that you feel like would help you be the most informed.
Evan, did you have a question?
I do, yeah, thanks. This is Devin. I work for Nevada County Public Health in Truckee. I'm curious, I thought we would have had a piece on maybe last week with the red flag warnings and the wind, and just any idea why we didn't, or I mean, how that, I just thought it was kind of prime conditions for power failures or outages. And it's just such a new thing here in Eastern County. I'm just curious if you have any thoughts on that, why we didn't have one.
So in talking with NV Energy, and it's really important to realize it's NV Energy, not PUD, Truckee Donner PUD, or Liberty that necessarily will have the piece on. Liberty does have the ability to do a PSPS separate from Truckee Donner PUD, but what we're talking about here is NV Energy and their transmission lines that come up through Dog Valley, the Stampede area, and then into Truckee. So that weather condition is really predicated on that area, more so than what we see here. While NV Energy has said that they will use red flag warnings as a potential indicator, what they're really looking at is some other thresholds that we didn't hit. What we're most concerned about is short notice, because as we all know here in Truckee and the North Lake Tahoe area, weather changes quite often. So right now we're sitting in a position where it's pretty good in terms of the weather is not hitting those thresholds, good and bad, because the reality is they're doing this to keep things from burning. So but yeah, they said we weren't even close last week, which gives me a good feeling. But they did have them further south around the South Lake area over on the eastern side, Genoa and the Carson City area.
Thanks, Bob.
Other comments or questions? I think one of the things that we talked about last week, and you all mentioned earlier, as far as getting information out to vulnerable populations, and how, I think to the point as far as the communities that were impacted by the power outages in Western County were individuals with disabilities, and how do we as a collaborative ensure that people who may not have access to the internet or other types of more formal communications are aware of any potential power outages or evacuations. And I know 211, it's a conversation we've had with you all. And so I just think if there's ideas from folks on this call about how we can ensure that the right information is getting out, I think it's a worthwhile conversation to have as a collaborative. So if anyone has any ideas or thoughts around that.
What I will say, Allison, is we worked on the west side closely with Freed and 211. I mean, Freed and 211 really developed a pretty good system. I think we didn't even realize what we didn't know during those first 2019 events. And then I think out of that, we started identifying a lot of unmet needs. And sometimes, I mean, that's not where you really want to be, right? You want to be in front of the problem, but the beauty of 211 was at least 211 could group those unmet needs, and then we as a county and then the nonprofits could start to try to address them. And then I think based on that experience, we were then able to come up with things to mitigate those issues, prior to 2020. So like we determined there was a major problem with really durable medical equipment, CPAP machines, oxygen concentrators, things like that. So that's where PG&E and Freed worked together to buy batteries and issue them out to people to try to mitigate that. PG&E and Freed also worked together and 211 to put people up in hotels that were outside of the footprint of where the outage was going to occur. So I think that it's identifying the problem and then finding solutions, sometimes creative ones, that really can only be executed collaboratively. I think that's where you have to be with your planning for these types of large scale events.
And then Jasmine, I kind of look to you as far as the role of Freed in the Tahoe Truckee area. I know we had talked about it a little bit last week, and then Caleb, we'll get to your question in the chat box as well after.
Yeah, so Freed, their services initially started because they were received funding from PG&E to support the power safety shutoffs. Because we don't have PG&E sourced power up here, it was a little different. Nevada County is exploring getting a contract in place for Freed to support Nevada County residents that need battery backups and durable medical equipment and potentially hotels. So that is in the works. And then Placer County has the same system set up, except they have the capacity to do it internally. So again, using 211 as the access point for Nevada and Placer County. If you are working with folks that are on durable medical equipment, getting them to register with their PUD so that they're on the list of durable medical equipment, and then having them be proactive about creating a plan. Not everyone is going to need to have need to rely on these types of resources. So again, we want to help people be proactive and having conversations with people that we have relationships with. And then if it seems like they would benefit from a little extra support, having them contact 211 to be proactive about making a plan on kind of when an event is happening. Placer County has resources to also do the same thing, and they'll have a social worker on site that will be able to triage if someone goes through 211. 211 identifies, hey, this person needs a little extra support. It's not something we can triage through a call center, and then Placer County will follow up with that individual to assess, is there a need for battery backup, hotel, what are the needs and how can we fill that gap? So there's systems set up on both sides of Placer and Nevada County to support that. And we just want to be getting the message out to the people that we serve that if you think you're going to need extra support, let's make a plan now and go through those steps so that it's not a total crisis, even though the reality is that there will be a crisis for some because not everyone is going to be able to take those proactive steps.
Okay.
Allison, something to think about too, just so everybody understands, because I didn't realize this until I started trying to figure out how to help these folks. An average battery for an oxygen concentrator is about $5,000. We don't have that kind of money, neither does PUD. There's a long reason why PG&E does, but the reality is that there isn't that kind of money for a battery system here. So we really are looking towards more of the hotel option where we can, if somebody does not like, Jasmine said, they go through 211, they work with a social worker and they absolutely don't have other solutions, then the hotels become a very, unfortunately, cost effective, but where the problem is getting them to the hotel and how do we move them in transportation. So, that's a thing that we still struggle with as we're putting this together. And Paul mentioned it's very much a work in progress for the east side of the communities because they haven't really faced this. The west side has faced it for 2 years and they've gotten pretty good at it. And we're trying to learn from them, but we don't have quite the same environment in what we're able to accomplish. So, like I said, I just want to put that out there that, we often talk about battery backup. Well, if somebody wants to buy that on their own, certainly that is great, but there just isn't really that capacity locally to pay for a battery backup when we could probably pay for, 20 hotel rooms with that same amount of money or more. So that becomes just a cost-effective issue that we have to look at. And PUD is certainly, Truckee Donner PUD has certainly stepped up and said that they'll be a part of that solution. So that's been comforting. We're just trying to figure out what that real need is right now. And I think that, somebody had mentioned it earlier, tell us how you folks are communicating with these folks that we're talking about, because what we're missing is how we communicate with them. You said it, you're so exactly right. They don't have internet access. They don't use the internet. They may have limited cell phones that they use. And so how are you getting the message out to them? And can we use those avenues to, amplify our message?
So I would open that up to the group, and I do see a couple of questions in the chat box, but we will get back to. But as far as folks on the call, how are you getting information out to the community? So Jasmine, you have your hand raised.
Oh, the other thing I was going to add is regardless of whether we have a contract in place or not, Freed is available to serve Placer and Nevada County with folks to help create plans for disaster preparedness. And so I will put their information in the chat. If you want to encourage someone to contact Freed now to come up with a plan, that would also be another resource.
Okay, thank you. So any comments from collaborative members on the call around how you're getting information out to the communities that you support during emergencies? Kelly, I don't want to put you on the spot, but I guess I am. Do you have anything from Sierra Community House? Oh, you can't hear.
Sorry, did you say Philly? Okay. Yeah, I was just reading at all the questions there, and I was wondering, I know I have been getting texts from Truckee PD, and sometimes those are in Spanish, but sometimes they're not. The other thing is like going through the school district will be helpful, I would think. I'm happy to discuss this with my promotora group. We're having a kind of a difficult day here at Sierra Community House due to some of our team members that lost a family member. But that's why most of them are off camera right now. They're trying to do many things all together. But yeah, I'm happy to just discuss with my team and get back to you eventually. If I hear any other inputs in Spanish here, I'll share with you all. Yeah.
Okay, thanks, Felicity. I'm sorry. I know it's been a lot, so I'm sorry to hear the sad news.
Yeah, it is kind of like a busy day for us. Anyhow, we're happy to be here. We're happy to be part of the conversation. And I'm glad to see that there's being interpretation in Spanish, so we can also hear their voices. Thanks.
And so on that note, River had put in the chat box if 211 texts are in Spanish, or if any nixles are in Spanish, or any of the emergency alerts. So I would, Tiffany, I'm not sure about 211, or Bob, if the nixles from Truckee are in Spanish as well, or anything from Placer, Nevada County.
So we try and translate where we can. It's all a matter of whether or not we do have a contract to translate, and also the county, and I'll let Paul expand on this, but we can use the county team if we need to. It's really a matter of timing as to how fast we're getting a message out, I think is one of the biggest problems with that, but we do try and do that. And as far as using the schools, it's a really interesting thing. The schools are going to be on one of the early notification lists so that they could start planning. But the earlier the notifications are, particularly as it surrounds the power outages, it's the less certainty. So, we may be telling the school it's 7 days, but we don't really want to put that out to the public because we just don't know it's 7 days. But they may be planning what the heck is going to happen. So they will be messaging, maybe not directly our message, although we certainly can use them, and they have talked about wanting to use or be able to use and amplify our messages, but their messages will be more directed towards what the school is functioning. Reality, I think it's about 5,000 kids right now, so you can imagine the impact on the community that has to get that message there. One thing I did see in the chat, and I just want to touch on this because I've had a lot of conversations telling people to go to the hospital. If they need to go to the hospital for a medical reason, that's fine. But what we don't want to do is inundate the hospital, who, quite honestly winds up, at least in the Truckee side, probably the similar from Placer, is the place of last resort, and everybody just shows up there because they don't have a better answer. And then they wind up in a situation, particularly with COVID now, where they have to go into lockdown, and getting people that need medical help into the building is much more difficult that way. So that is not a place we want to send people necessarily. I think the idea is good to send them somewhere. I'm just want to put that out there that the hospital is already struggling greatly with, how do we serve the community when we may have power, but it's because we're a medical facility, not because we're a place where we want a bunch of people to show up. That makes sense.
Right. Yeah, that makes sense. And I know I feel like there's been conversations around like where those community centers ideally will be. as far as where people can go charge their phones or their laptops, or again, plug in any equipment. And I assume that that's information we'd be able to send out through the collaborative were that to happen.
Right, and right now it looks like it's going to be the airport. That one is fairly strong. We have a facility at our old courtyard, which is kind of down Truckee Pines in the senior area. And then we're working with Tahoe to finalize something there. So as soon as I get those and have them carved in stone, I will get that out so everybody knows where they're going to be. But there will be community resource centers on the east side, similar to the west side.
Okay, that's super helpful. And I think, again, back to Dave's comments in the beginning, like how to ensure that we're getting the right information out from the right folks to the community. So that sounds like the right information that we will help push out for sure. Okay, any other comments around this topic in particular, around getting information out to community members, the role that our partners on this phone call can play? And Sandra, I want to make sure if there's any questions. So this is the room, the conversation's in English. Sandra is translating into Spanish in the other Zoom room. So any questions from your crew? Okay. Okay, and so I'm gonna make sure we're hitting all the questions. Kayla, I do see your question about the school district, and then Susan Smith, is the rec center is an evacuation site? Could it also be for a gathering?
It could if we don't have a power issue. The biggest problem we face with the public safety power shutoffs is we do not have very many buildings on the east side that are generator protected other than the hospital. There is limited resources at the school, not enough to actually use them for a community resource center. And the rec department doesn't have in any of their buildings currently backup generation for generators or loss of power. So we could go to those areas, and we will use one of them probably for a temporary evacuation point, but that's all dependent on where the event is. Because we don't want to send people ahead of time, pre-designate a location that turns out being in the path of whatever's going on.
Okay, that's helpful. Okay, so other questions. So Kayla, your question about the school district was addressed, and we can check in with Carmen as well as far as when they will be setting out information. We heard from Truckee around Nixles going out in Spanish and working with the county on that. Anything else from Placer around information going out in Spanish from you, Dave, or anything from 211?
You know, we're very similar to what Bob mentioned. You know, we have a few things that are pre-translated. We try to use those when they fit. Unfortunately, it seems like every disaster is a little bit different. And then so, you know, our translation services are somewhat limited. And so, you know, getting that out quickly and then trying to get it translated and out, you know, continues to be one of our goals, but also one of our challenges, honestly.
Okay.
And for 211, we send out alerts in English and Spanish, and we also have Spanish translators in the 211 contact center. So 24 hours a day if anyone calls in about that information too.
Okay, thank you, Tiffany. Okay, so other questions or comments. And so I think, River, you have a comment in the chat box. For resiliency purposes, we probably need to establish more generator backed up buildings on the east side of Placer in Nevada County. There was some agreement. So any comments on that from the county? I see Robert Womack says that the town of Truckee is working with the rec center and senior center to get grants to do that. Okay. Any other comments around generators in general?
Yeah, I heard, this is Devin. It's a pretty involved process, especially fees and, you know, they're looking into it, I know, for the Joseph Center, but it's a pretty big ordeal, I think in the hundreds of thousands of dollars to get the whole building to fire adequately. So it's something they're looking into, but it's, you know, it's a lot more complex than just setting up a couple temporary generators to get these facilities, you know, up and safe and functional with Wi-Fi. And we've had to look pretty hard. Even our building is connected just to across the courtyard to the jails, and only our really critical essential things are still fired up by that generator for vaccines. And there's a lot of undertaking going on, and they're thinking about it and working on it.
Okay, that's helpful, Devin. Thank you. So any other comments or questions? So I think my final comments while I'm waiting for any additional ones is, Jasmine, I feel like last week was definitely kind of like a trial run as a collaborative around, not even a trial run, but like a practice around how we get the right information out to our 42 partners. And there's so much information coming out from so many different groups. And I think in particular last week, the evacuations were in El Dorado County. Our partners primarily serve Nevada County, Placer County, the town of Truckee, some Washoe County. And how do we ensure that everyone's on the same page? So Jasmine, I really want to commend you for the updates that you gave last week. I thought you did a phenomenal job, like filtering everything that needs to be filtered from Placer County and Nevada County, as well as the towns. That was really helpful. Christina and I talked a couple of times throughout the week around using the bulletin to send out information, although information changes so quickly. We do have our collaborative Slack channel that we did post things to. So I do encourage you to look at that as a resource. And again, back to Dave's comment about making sure we're getting the right information out. Like that's a way that all of us can access information if we happen to have internet access. So I do think it's an evolving conversation. I definitely heard from folks on the call. I think as a collective, we can work on ensuring that our materials are translated and that we are getting information out to our Spanish speaking communities. I know we haven't talked much about our individuals who are experiencing homelessness, but I know it's a conversation our Homeless Coalition is having around how to ensure that we're getting information out to our folks who are experiencing homelessness. And it sounds like there's some opportunity to work more closely with Freed and to support those services in Eastern counties. So is there any other takeaways or anything else we want to move forward on as a collective, or any other questions for our amazing folks from the Office of Emergency Services? So questions for Dave, Bob, or Paul, since they're on the phone. Okay. So, and I apologize, there is one question in Spanish. So would somebody be willing to translate that for me? Sandra, can you translate it? Can you toggle over? Sorry.
Yeah, sure.
Thank you. The Zoom technology is really new.
Yeah, so Stacy is asking like what kind of capacity the evacuation center will have in Truckee. I should say.
Okay, so the capacity of the evacuation center in Truckee. So Bob, is that something you could answer?
Yeah, and I'm going to dance a little here. The reality is, if we had an evacuation similar to what we have now seen in South Lake Tahoe, which 4 or 5 years ago I would have said wasn't going to happen. 2 years ago I would have said that fire doesn't burn the way it did. So now I've totally changed my thoughts on some things. But the reality is, if we had that kind of evacuation, we would be pushing people to Sacramento and Reno, depending on the routes available. We would not be doing evacuation centers in Truckee. We have the ability to have larger evacuation centers than the 20 persons we had at the Vets Hall, but we have to try and temper that with what are the needs and how much do we disrupt the rest of the community. So in this situation, we could have gone to the rec center, the new rec center. However, that we would never have needed the capacity we had there, and we would have disrupted the community completely, particularly after school, programs, before school programs, preschool. So we have to kind of balance that. And then it's a matter of, do we want to even evacuate people to Truckee if we have an event in Truckee where we're going to move a whole subdivision? We're talking 1,800 homes, 6,500 in Tahoe. We probably don't shelter those people in Truckee. We shelter them in Reno, where there's a larger amount of services. So that's the plan, generally speaking, is if it's of any significant size, we're putting people on the highway and we're getting them completely out of here, because otherwise our roads and our infrastructure are not going to handle an evacuation back into town. Rather, it's set up to get people onto the interstate and out of here completely.
Okay, that makes sense. It was a good dance.
Yeah, it's one that I've spent many years working on, and we do have a lot of capacity here, but by the time we get people here to support us, we're just as well to try and go to Reno or Sacramento.
Right. Okay. Thank you. Okay, so any other final questions, comments? Okay. Well, Dave, Robert and Paul, we really appreciate your time. We really, we recognize you are very busy, and we are really grateful for all the work that you are doing. And we appreciate the complexity of the situation. Many of our partners on this call work across county lines and across jurisdictions. And so we know how complex that can be. And actually, before you go, Maribel, I see your hand in the air. Do you have one final question? Maribel, do you have a question? No? Okay. Okay. Well, thank you so much. We appreciate you being with us this morning, and you're welcome to stay if you'd like, but we know that you have a lot going on. So thank you.
Thank you very much.
Okay. So before we move on to the resource sharing component of the agenda, which is probably 10 minutes or so of you all having an opportunity to update each other on what's happening with programs, with services within your organizations, we just wanted to do a small group breakout for probably, let's give us 15 minutes or so, Christina. And then if folks underly, they can turn off their screens. But we just really wanted to give everyone a chance to connect. Again, we recognize everyone's coming back from, hopefully a lot of people are coming back from a 3-day weekend, and it's been a really difficult few weeks on top of a very long year. And we have talked to so many of you over the last couple of weeks around, or just about how tired folks are, how difficult the work has been that you all do. So we just wanted to really provide an opportunity for you all to check in with each other, just really have an opportunity to share. And I kind of put some guiding questions in here that you can leave or take, but what's one takeaway from the conversation today? What's one thing you could bring back from your organization? What's one thing you learned? And then again, the speakers talked about community resiliency. And so there's been a lot of conversations in the meetings I've heard around resiliency in general. And so, oftentimes in a state of emergency, what we can focus on and what we have agency and control over is our own resiliency. So our resiliency amongst ourselves, our friends, our families, our communities, and within our organizations. And I know in times of extreme stress, resiliency can really start to crumble. So I also just put a question on there. For all of us, how do we maintain our own resiliency, both personally or professionally? So again, these are just questions. You can answer one of them, you can answer two of them. And Christina, for purposes of small groups, maybe you already put this in the chat, I believe that if you are in the Spanish speaking Zoom chat room, you are going to be in one room together, Sandra, so you could help with any translation. So if you could go ahead and put your name in the chat box. Is that correct, Christina?
That is correct.
Okay, great. And so if you are in Sandra's Zoom and you're listening to the interpretation version of this meeting, if you again could put your name in the chat box so we can ensure that you are in one chat room together. Okay, so before we wrap up, I'm gonna kind of circle back around. Raoul, are you still on the call?
I'm here. Sorry, I had a pretzel in my mouth, so stacked with meetings.
I'm glad you're
including
having
at
a
noon.
snack.
So it was quite delicious. So
Good.
Sorry about that.
So happy.
And, yeah, good. So I think the question was about testing for the new strain. I think was sort of the spirit of it, right? All right. So the PCR tests and rapid antigen tests that you take only determine whether you're infected with COVID-19, not any specific variant associated with that. So what the hospitals do and providers do is submit samples of some of those of some folks who are infected with COVID-19 for genomic sequencing, and that determines sort of the strain associated. So right now, I think it's like 95%, if not higher, of all the tests that are coming up positive that are sampled are Delta. variant right now. So that doesn't happen for everybody. Again, the tests that you get, PCR, antigen tests, those only determine whether or not you have COVID-19, and variants are detected through genomic sequencing. So separate process, and not for everybody, just on a sample of folks.
Okay, thank you, Raoul. I hope you enjoy your pretzels. Any other comments, questions, updates? Laura Brown.
That's actually just I have a follow-up question for Raoul. So is the antigen test just as reliable as the PCR? It just doesn't give you the breakdown? I mean, generally speaking.
Yeah. So let's see. I'll try to keep this simple, because I know I can go down rabbit holes on PCR tests and rapid antigen tests. So antigen tests are quick tests. You see them growing in popularity right now. In fact, it's hard to find them at Walgreens if you go for the home test. They're particularly useful right now because Delta, again, has 1,000 times more viral particles associated with Delta than with sort of the original strain. So it makes rapid testing, antigen testing, really effective because it does a good job of detecting virus, whereas before you'd get a lot of sort of false negatives associated with rapid antigen tests. They're really good right now because Delta is so catchy and there's so much of it. So if it shows a positive, you want to get a confirmation using a traditional kind of PCR test. So that's the gold standard. That'll make a almost 100% determination of whether or not you have COVID-19. But antigen tests are doing a really good job picking up Delta.
Thank you, Raoul. Any other questions for Raoul since he has the floor?
And then I'll just say too, while I have the floor and no pretzels in my mouth currently, there's been a lot of controversy around PCR tests among some, I'll say, not many, but among some, and around their reliability. Very reliable test, right? And then for so much so that law enforcement actually uses PCR tests on DNA samples for potential suspects at crime scenes, right? So long-standing use of PCR tests remains the gold standard, is the gold standard for detecting COVID-19 among, and lots of other things too.
Thank you, Raoul. Okay, anything else since you're all together?
I was just going to say, Allison, this is Devin. I know the LHI site in Truckee seems to be pretty popular, which is great. I think they're open 12 hours a day, Monday through Friday. And I know a lot of people that I've talked to weren't aware that if you're already in the system for a test, you can do a walk-in. So it's helpful to know that if you have to know your patient ID number, but.
Okay, that's super helpful, Devin.
Yeah, and I did one for my daughter maybe a week ago. It actually came back in like a day,
okay,
which was pretty rad.
That's great to hear.
Yeah.
Okay, anything else? Okay, so Maribel, I see your comment. So for all of, could someone translate that for me, please, or for us?
She can't hear the Spanish translation.
Oh, bugger.
I think I can give support with that since we're almost like 5 minutes. Yeah, okay. I'll follow up. Yeah, with my team. Thank you.
Thanks so much. Okay, Christina, am I forgetting anything else?
I don't think so.
Okay. So
if you could take time to fill out our evaluation form, if that's what you're just going to say.
Yes.
That would be very helpful to us.
Yes, and again, this is your collaborative, so we are open to any and all feedback. And again, we always encourage folks to join the Slack channel and post resources on there. It's probably like our most expeditious way of getting information out to our collaborative partners if folks utilize it. So it's there if you're interested. And thank you all again. Thank you so much to our speakers. We hope you found the information valuable, and then we will see you all the first Tuesday in October, and we will be chatting with a gentleman from the Washoe tribe. So I hope you all take care of yourselves and your families and your communities. and have a good Tuesday. Thank you.
Thank you.